I think that's such a common question that I get asked probably every day. Every time we mention implants, I think a lot of the time, obviously cost is an issue, but even more than that is people are worried about having the procedure done. They're scared, they're frightened. And I must admit myself, even though I'm married to someone that does implants and is a specialist prosthodontist, before I actually saw Nick carry out the procedure, I probably had a much more dreaded thoughts about what actually happens when you have an implant done. I think we've been very lucky over the last 2 to 3 years because Nick has developed a technique which is more keyhole called guided surgery. The beauty of that is it actually eliminates a lot of the horrible stuff that you might have thought happens with implants. So there's no scalpels, there's no cutting, there's no stitching. Post-operatively, there's a lot less trauma. So what happens is you have a 3D X-ray, if you like, of your jaw before you have the implant done. Then Nick would look at the CT scan, we call it, and he would plan exactly where he wants to place the implant, so the optimum site for the implant. He then sends that to his technician in London who has a 3D printer. He prints out a surgical guide. So on the day of surgery, there's no cutting and no scalpels, as I said. What happens is a little punch of gum is taken out through the guide, and then the implant drills remove the bone necessary, and the implant pops into the hole. The stent's taken off, or the surgical guide's taken off, and there's no bleeding, no stitches, and actually people of quite an elderly age now are able to have the procedure done because it's such a simple procedure. It's much more keyhole than it ever has been, and post-operatively really people are fine the next day, that they don't have the swelling or the bruising. And people have commented previously to us that they've had the procedure done before the guided or before the keyhole surgery and afterwards, and they've found that the new way of doing it with the keyhole surgery is amazing, that the difference is quite astounding. So I would never myself now be fearful of having an implant placed. I think it's a very straightforward procedure. Often I'll run in to see one of my patients who's having the surgery done next door, and it's already finished because it's happened so quickly. So I think that never be fearful of having an implant because of the trauma or the cutting or the nasties, because that's all been taken away now.